Hi, I'd like to go through the Insight 100 user screen so that we can go ahead and identify to you the various options that you have as an operator, entering patient demographic data, checking the water level in the instrument, and a few of the commonly used tools that are on the instrument screen. Over here we have the area where you would enter in the patient demographic data right from your medical records. We can simply type in last name first, first name, enter in the birth date, and then you would simply hit the save button to keep that patient. At this point, there's the patient name here. Down in the lower right-hand section of the instrument is the water icon. Clicking on that, prior to each patient coming to the instrument, you want to make sure that the water level is at the halfway point. After you install the eye seal on the instrument module, then you can go to the fill point. Between patients, right away bring it back to the halfway point. Only at the end of the day would you click the drain, and that brings all the fluid out of the instrument module back down to the fluid reservoir down at the bottom. At the end of the day also, you go ahead and leave the eye seal off, leave the instrument wide open so that it can just air dry. Don't worry about things getting in. The filter would take out any little particulate that might enter into the system. So back to the screen. Here on the screen, if I were to select the patient, and then I move to the Scan tab. Here on the Scan tab, these are the various options that you have for the various tests that we have. Entering in the first operative eye, right eye in this case, whether it is a pre-op or a post-op patient. And by the way, you can type in anything you want in that section, but those are just the default selections. And here is the list of the various types of scans that we can do with the system. The anterior segment scan, simple bicanthal scan. The capsule is the entire lens, so it's multiple focusing points. The cornea scan for your pre-op, post-op LASIK patients, SMILE patients. Glaucoma scans. This is an automatic report of all of the Pavlin standard measurements of the iridocorneal angles. The whole glaucoma screening is a new set of tools that we have where you get the multiple quadrants, 12 o'clock, 9 o'clock, 6 o'clock, 3 o'clock. In this case, the instrument is pointing through the scleral wall to get the nice anatomy inside the eye. Here we have your various ICL scans. The anatomy scan is one where the multiple meridians are taken so that you can look at where the ICL footplates would sit within the eye. The nomogram scan. This is the next scan that you would take, so you would take an anatomy scan and a nomogram scan of the patient. The nomogram is the one of which you will take measurements from. The ICL vault is the post-op. And then the last four are simple single scans for the glaucoma. So with that, we could select just a straight cornea scan, and then we would be ready to go. Once the patient is on the instrument, in this window here, you would clearly see the patient eyes. And we have other videos that we have available to you to talk about patient positioning and what you should see in this monitor that are covered in depth on those videos. Once the scan is complete, all of your images are here. Again, we will cover those in separate images. But this is the basic startup of the system, filling the fluid levels, draining the fluid levels, etc. I hope that is helpful.